of which sheet, which fascia? Fascia transfer studies and fascia iliaca. Fascia transfer studies and fascia iliaca. Both of them are going to continue for the femoral sheath. Femoral sheath has 3 compartments. The femoral sheath has 3 compartments. This picture, you are at exam. I'm going to give you this picture. Look at the picture. It is the iliopsoas tendon. Here you have the pectineus. Medially in the femur, laterally in the femoral triangle. These muscles are going to form the floor. And we know from lateral to medial, we are able to show you femoral nerve, femoral artery, femoral vein. Medial to femoral vein, here we have femoral channel. The femoral artery, femoral vein, and femoral channel are going to cover by the femoral sheath. This femoral sheath is continuum of 2 fascia, fascia transversalis and fascia iliaca. What about the femoral nerve? It's not covered. No, it is not going to be covered by the femoral sheath. It is not going to be found inside of the femoral sheath. Okay? Now, look at the picture. This is the femoral sheath. 3 compartments. Lateral, intermediate, and medial. Medially, you are going to look at femoral channel. Intermediate is position of the vein, and lateral you are going to look at the artery. Here you are going to look at the adductor group muscle, adductor magnus, pectineus, gracilis, adductor magnus longus, and brevis. Okay? All of them, most of them, the function is adduction, and most of them, the nerve innervation is coming from the omoplata. You should know the pectineus is going to innervate by the femoral, and the adductor magnus is going to innervate by the obturator and the sciatic. Okay? And about the function, all of them are adductor. Only you should know that the adductor magnus, adductor longus, adductor brevis also help to lateral rotation. These 3 adductors also are going to help to lateral rotation of the femur. About the pectineus, it is the adductor, but it is also going to assist to the flexion of the hip joint. It is going to help to flexion of the hip joint. About this picture, again you are going to look at to the muscle in the medial compartment of the thigh. Look at to the some of the muscle that in medial compartment and some of the muscle in anterior and medial are coming to attach to the tibial. Which of the muscle in adductor compartment the tendon is coming down to attach to the tibia? Medial compartment. Which of the muscle? Gracilis. I told you 3 muscles. The tendon inferior are going to attach to upper portion of medial surface of tibia. In the medial compartment, remember gracilis. In anterior compartment, remember sartorius. In posterior compartment, I told you the name, semipendinosus. Now, muscle in the 3 compartments of the thigh. Some of them are visible here. Here you are going to look at the anterior compartment. To anterior compartment. Please look at to the quadriceps femoris. Quadriceps femoris. You are able to look at to the sartorius. And in the posterior compartment, later I am going to explain for you. Which nerve is here? And the medial compartment, some of the muscle, and the nerve that is responsible here to innervate is obturator nerve. Now, the last thing for today, you remember the brachial plexus? Yes? Are you ready to draw for me the brachial plexus? What you should know, such as the address of your home. You should know that how to draw the brachial plexus. About the lower lip. It is one of the questions. I'm going to tell to you one of the final questions. The lumbar plexus, you should know how to draw and write the name. I'm going to explain for you. The femoral plexus. The femoral plexus, such as the brachial plexus, some of the spinal nerves are going to join to each other to make the lumbar plexus. Never we see about the spinal nerve in the cervical region to participate in the lumbar plexus. Okay? Never we see about the superior spinal nerve in thoracic region to participate in the lumbar plexus. In lumbar plexus, please remember L1, L2, L3, L4. To be able to draw the lumbar plexus, remember some root, some spinal nerve. Each spinal nerve, the first lumbar, the second, the third, and the fourth lumbar spinal nerve. To be able to draw the femoral plexus, at the first draw this picture, M, but not horizontally, vertically. Okay? To be able to draw the femoral plexus. How you write the M is part. Now you rotate and draw a huge M, but vertically. L1, L2, L3, L4. All of the ventral branch, all of the ventral nerve that belong to the L1, L2, L3, L4 are going to participate to form the lumbar plexus. L1 receives some of the branch from T12, not all of the branch. Some of the branch from T12 is going to participate in lumbar plexus. L1, after receiving some of the branch from T12, divide to two branches, superior and inferior branch. Superior branch we call ilio-hypogastric. 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 The second branch we call ilio-inguinal nerve. So ilio-hypogastric nerve, ilio-inguinal nerve. You are at exam. It is possible I ask you, which of the following spinal nerve are going to participate to form the ilio-inguinal? Which of them? For ilio-hypogastric, L1 and L2. Now, L1 received some of the branch from T12, divide to two branches. Superior branch we call ilio-hypogastric. The second branch we call ilio-inguinal. Another branch, another nerve that belongs to the L1 and T12 are coming down, join to some of the branch from L2, make a nerve that we call genitofemoral. We call genitofemoral. We call genitofemoral. L2, L3, L4. All of them. L2, L3, L4. Divide to two branches. Anterior branch and posterior branch. Anterior branch of L2, L3, and L4 L4, L2, L3, and L4. Okay? Divide to anterior and posterior. Imagine here is the anterior. Okay? This blue color is going to remember you anterior. The anterior branch of L2, anterior branch of L3, anterior branch of L4 join to each other make the obturator nerve. The posterior branch I use from the red color. The posterior branch of L2, posterior branch of L3, posterior branch of L4 join to each other and make femoral nerve. Femoral nerve. Do you remember the anterior compartment of the thigh? Which nerve was responsible? Femoral nerve belongs to lumbar plexus. Medial compartment, the obturator nerve is responsible. Belong to which plexus? Lumbar plexus. So obturator nerve, femoral nerve belong to the lumbar plexus. They are coming to the lower limb to be able to innervate some of the muscles, some of part of the skin. Femoral nerve and obturator nerve. Again, I explained for you to be able to draw. I told you at the first, draw a vertical M, L1, L2, L3, L4. L1 receives some of the branch from T12, divide to two branch, ilio hypogastric, ilio inguinal. Another branch from the L1 and some of the branch from the L2 join to each other and make a nerve that we call genitofemoral. We call genitofemoral because very soon this nerve is going to innervate the thigh region and the genitalia, the external genitalia. The L2, L3, L4, each of them divide to two branches. The anterior branch join to each other, make a nerve that we call obturator. The posterior branch from L2, posterior branch from L3, posterior branch from L4 join to each other, make the femoral. Another branch in lower limb, I'm going to explain for you that it is responsible to innervate the skin of lateral border of the thigh. Lateral border, lateral side of the thigh, the skin is going to innervate by a nerve that we call lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh belong to the lumbar plexus. Do you remember the posterior branch from L2, L3, L4 join to each other make the femoral nerve? From L2, posterior branch, and from L3, posterior branch join to each other and make another nerve we call lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. This nerve is responsible to innervate the skin, cutaneous skin of the thigh. Which part? Lateral. You get that, please? You know that one of the questions for final exam in lower limb belongs to the lumbar plexus. Today, I'm going to introduce to you and explain for you the lumbar plexus. After 1 month, 2 months, you are in the final exam. Remember, one of your questions is lumbar plexus. Please study and try to get in your mind to be able in your exam never lose the time for lumbar plexus. Very soon you draw and name. If you have any questions.